These pieces of paper that we're handing out pertain to the first presentation in this next group. So you'll each get a different one. I'm going to hand them to the first person in each row. If you can pass them down, don't cut each other. They're very sharp. And try to get the best country. Each one is a different country.
Can you hear me? Can you hear me? Okay, all right. So I'm Robert Bourgoin from the Global Fund to Fight AIDS, TB, and Malaria in Geneva. I don't know about you, but I was personally quite inspired and impressed by the quality of the presentations which I heard over the last 2.5 days. And I was struck by the fact that most of them, if not all of them, highlighted the importance of working together, the importance of partnerships, making sure that our systems can talk to each other, that our data is portable, and so on. So in a minute, we will hear a few examples of those websites and web-based initiatives which are the result of successful partnerships. Very short presentations, because we are running like more than half an hour behind schedule, unfortunately. So they will be about 2-minute presentations each. We will also hear a few words from Dennis Gilhooly, who is the principal advisor at the United Nations Office for Partnerships. But first of all, I would like to introduce Mr. Peter Salama, who's the Chief of Health at UNICEF, who wants to present a challenge to the tech community. So Peter Salama.
Thank you very much. I'm going to start by, before I present the challenge, showing you some data. And ask you to listen to not just the absolute numbers in the data I'm presenting, but actually the way it's presented. And think about how we present this data and how we could present it in a more compelling fashion. The first data is on this slide. And it's some of the most powerful data UNICEF's probably ever presented. In 2007, the number of children under 5 dying every year fell below 10 million for the first time in history. To put that into context, in 1960, the number of children under 5 dying every year was 20 million. I hope this is what this meeting is about and what we're all here for, how to actually improve these indicators. This was the front page of the New York Times, so we did something right in presenting this data. Where does all the data come from? You've probably heard a bit about this during the conference. It comes from multiple indicator cluster surveys. They're national household surveys that UNICEF supports every 3 years in developing countries. In conjunction with the demographic health surveys supported by the US government, this supplies the majority of all the data on health that we have for developing countries. So we're in a great position here to work with you because we have these data, we have these databases, we need to make them accessible to the general public and the world. So this is some of the ways we present data to make a case. This is a case that we're making progress. In 2000, the number of children every year that died of measles was about 750,000. A group of partners, including UNICEF, CDC, the UN Foundation, WHO, and several others, got together and said this was despicable, and we needed to drastically decrease the number of kids dying every year of measles. In this slide, 1 dot equals 1,000 kids that die every year from measles. 1 red dot. So that was the status in 2000. In 2007, the map looks like that. Look at the disappearance of those measles cases, particularly from sub-Saharan Africa, and note where the majority of the red dots remain, on India. What are the causes of death? Pie charts are a favored species of presenting data for people who work with me in global health. And you can see the basic causes of death actually haven't changed significantly over the past few decades. Newborn causes, neonatal, pneumonia, diarrhea, malaria, measles, basic causes of death, the majority entirely preventable. One of the most important partnerships we've had is represented by the pieces of paper in front of you. They're country profiles. This is called the Countdown to 2015. It's a group of about 100 partners that work together to present data on countries about the status of their improvements on health, the status of the health MDGs, the status of coverage of key basic services that could make a big difference. Last year we did something innovative. We partnered with the Interparliamentary Union to present this country-by-country data to all speakers of parliament around the world. It had actually a major impact. Since that meeting in April last year in South Africa, parliamentarians have taken those data sheets you have in front of you back to their parliaments. They've asked UNICEF and partners to explain the data, present it to budgetary committees, present it to policymakers so that we can make a difference. Clearly the data could be improved in its presentation, and we ask you for your ideas. Another form of the way we present data is, of course, in maps. This is a map of the world drawn proportionately to the geographic land mass in the world. I'm going to show you some different ways that we present data, particularly to our donors, to make the case about the inequitable distribution of global health parameters. This is the world map according to newborn mortality, the proportion of children that die every year in the first month of life. Look how large Asia in yellow and Africa in red have now become. Any guesses for what this world map is showing us?
AIDS.
HIV/AIDS is a good guess. It's not, but it would look very similar. Any others? Malaria. This is the malaria map. Look at Africa. The majority of disease burden. You can't see the Western world really very well anymore. Any guesses for this one? Africa's almost disappeared. Obesity, good guess. But actually, if it was obesity, you'd get some real bubbles around urban centers, even in Africa. ODA, another good guess. Not quite. Diabetes, good guess. Not. It's actually physician density. So compare that to your malaria map, and that basically explains in many ways the incredible geographical global inequities we face across the world.